Good evening. My name is George Miller, and I am the Director for the Oakland County Department of Health and Human Services. Thank you for being here. With me is Kathy Forsley, who is our Manager Health Officer for the Oakland County Health Division. Next to her is Dr. Pamela Hackert, who is the Chief of Medical Services for Oakland County Health Division. And next to Dr. Hackert is Bill Rodella, who is the Health Officer for Macomb County Health Department. First of all, I want to let you know that there's a case of bacterial meningitis in Macomb County, on a Macomb County resident that has impacted Oakland County. We were notified today, the Health Division here in Oakland County was notified today of a Lifetime Fitness day camp employee in Rochester Hills with bacterial meningitis, and as I mentioned, is a Macomb County resident. Obviously, the individual cannot be identified because of laws protecting personal health information. But we're here tonight to try to bring you as much information as we can to get this out to the general public. Forsley to fill you in on some of the details at this time.
Good evening. This disease is not spread through casual contact or simply being in the same room as an infected person. A person must have direct contact with an infected person's saliva or nasal secretions. If exposed, the incubation period is 1 to 10 days. Oakland County Health Division is in the process of identifying and contacting persons who may have had close contact with the case, including staff and day camp participants from the dates of July 1st through July 11th. And now I'm going to turn it over to Dr. Hackert.
Good evening. Persons who may have been exposed could begin to develop symptoms of meningococcal disease at any time up to July 21st. And although the risk of this disease, the individuals who were described above should be advised to be alert for signs of meningococcal disease. These include sudden onset of fever, a headache, stiff neck, confusion, and you can also have a rash. If any of these signs or symptoms should develop, the individual should be taken immediately to a physician or emergency room to be evaluated for possible meningococcal disease. Bacterial meningitis is a serious illness, and it can develop quite quickly. So when the range is 1 to 10, it can develop quickly. It also can be prevented, though, through antibiotics after exposure, and the people who have been contacted by Lifetime Fitness and the Oakland County Health Division have been told that they had been potentially contacted in this case and they should receive antibiotics immediately.
To reduce the spread and risk of any communicable disease, it is recommended that campers and staff not share items that come in contact with another person's saliva, such as foods, drinks, lipstick, balm, or cigarettes. Parents or staff members who have any questions may contact the Oakland County's Nurse on Call from 8:30 till 5, beginning tomorrow at 800-848-5533. And if anyone needs more information about bacterial meningitis, please go to www.oakgov.com/health.
As has been mentioned, we are in the process and have been for most of the evening in contacting these families, and will continue to do so until we've reached them all. I will point out that I think it was mentioned already that Lifetime Fitness is working very closely with us, and that they in fact have already emailed a letter to the parents informing them of our concerns and the need to get to a medical physician for immediate attention. And so that's been done. Our nurses that we have with our epidemiology unit, CD unit, I've been diligently working and making these phone calls, and as I said, we're going to go back and continue to do so until we reach everyone. At this point in time, we'll open it up to any questions you may have.
When anybody hears in South Pacific kind of a panic and a scared feel, what would you say to those parents and those folks who are obviously going to be frightened?
Again, for those parents in particular whose kids were at the camp, they're at the highest risk. That's the ones that we are concerned about right now, and that's why we're contacting them immediately to make sure that they get to a physician to be assessed at this point in time. Anyone that had other contacts with other people don't have the same concerns, the same risk factors.
Is there a vaccine for this? Is this a result of people not getting their kids vaccinated?
Go ahead, Dr.
There is a vaccine for some of the strains of bacterial meningitis. It's recommended at to have gotten the vaccine. But even then, even if you are vaccinated, it only covers the majority of these strains, and we have not been able to identify the strain at this time.
What's the age we're looking at, the kids that attended this camp? How many folks are you looking to notify?
I believe the number of the campers that we've been notified about is about 219 campers, and I believe the age range is from 5 to 12.
And can you reiterate again for our Facebook Live audience of where this is and who has the bacterial meningitis and how the students came in contact with them?
It is a camp employee that worked for Lifetime Fitness out of Rochester Hills, Michigan. This person was only specifically working with the day camp, as we understand it, and therefore that's why, again, we are focusing on the 200-plus attended.
What's the stat? How is that person who is infected? How is he doing? What's his condition right now?
I don't have that information at this time.
Hospitalized.
Yes, right.
Is it possible to give an age of the victim, however you want to call it?
Can't give out any personal information.
But that person remains in the hospital, right?
As far as we know, correct.
And that person is an adult. Sometimes they would hire,
Right.
younger people during the summer to maybe, so that is an adult.
It is an adult, correct. Bacteria.
So there is viral or bacterial meningitis, and this is this is bacterial meningitis. You can identify that through a lumbar puncture, and the meninges is the protective outer layer of the brain and spinal cord, so it can affect the whole continuum of.
What happens next? Are they going to have to Clorox all the walls and everything at Lifetime Fitness? And
No. So
disinfect everything?
this bacteria is a very fragile bacteria. It has to actually have direct contact from one person's nasal or oral secretions to another person's oral or nasal secretions. It's very fragile. It does not survive on surfaces like that.
So for those folks who would be scared about sweat, it's hot out, and that type of stuff, that has nothing to do with it.
No, we're being very careful because it is a serious disease, but it is only through oral or nasal secretions.
You mentioned the number of people at the day camp. Do we know how many people are being tested for this, if they are being tested?
Let's just say, at this point in time, we have recommended that everyone go in for an assessment, and we're also...
Everybody that goes to Lifetime Fitness in?
No, the 200
camp.
day
Okay.
camp plus attendees are the ones that we're recommending and be assessed, and we're recommended that they get on the antibiotics at this point in time.
Day campers from July 1st through July 11th.
Correct.
And
Yes.
some of those are in Macomb County, and some of those are
Right.
in Oakland County.
True.
That's why I want to make sure that
So
this message
get
gets out to
tested
both.
and also get antibiotics.
Get
regardless of
assessed.
If you were fit into that time frame.
Yes.
sort of that-
Yeah, let's make it clear, it's not tested as much as assessed, and get on the antibiotic. Correct.
And in addition to that, the adults who worked directly with her in the day camp.
Okay. That day camp, is it restricted to one portion of the building, or?
We don't.
Don't have that
we don't
information at
have
this point in time. Haven't focused on that as much as, again, getting a hold of all these people.
So have you reached everyone, or are you still in the process?
We have reached everyone that we've been given contact information for. In some cases, it has been leaving a message, and also the fact that in their inbox they will have an email from Lifetime Fitness that will also provide information that they need.
And just to calm fears, it seems like it's a very minute chance that, I don't know, maybe the nasal or the oral gets passed along. So just to calm fears once again, does this look like it's a very small possibility that somebody else might have gotten this? Or
It's a hypothetical guess at best, to be honest with you. You got to remember, little kids love to put things in their mouths. They love to share things. So, again, we don't know until we start watching the symptoms and watch the days go by. And again, I just want to reiterate what Mrs. Forsley said. Our nurse on call number, which is available 8:30 to 5 Monday through Friday, will be open tomorrow. That number again is 1-800-848-5533. Anyone that has questions or concerns should call that number. And again, we're going back to continue working on these cases, so we just wanted to get it to the end. I think that you get out for us also will assist as well.
This is very rare that you call a press conference this late at night. Does that speak to the danger and just the overall concern?
It speaks to the impact and the response, the quick response of public health these days. As we know what we know, and we want to get the information out, and it's a lot of people, and it's also children. And whenever it's children, you want to try to get this information out as quickly as you can. And so we're being diligent about it.
I think the importance of this being cross-jurisdictional is important between Oakland and Macomb County. We've been on the phone for this afternoon a couple of times, and we thought this was important. And our presence here to make sure that if Macomb County residents want to call our department, they can call 586-469-5235. 5235. If they have any questions, they want to call any of our nurses.
Again, I know you can't say because of HIPAA laws, but I'm going to ask.
Yeah, I was going to say that she said it, but you said her, so
I did hear you say that, but I just wanted to.
Yeah.
Any other questions? All right, thank you very much.